obviously great news for this new testing site for the community. Talk a little bit about why this was so important right now, especially with the Delta variant on the rise.
For sure. I mean, obviously there's a very large footprint of vaccines and testing on the private market. With the rise, obviously there's a very strong surge of COVID-19 with the Delta variant, both here in this county and throughout the nation. We wanted to make sure that we had all the options available for our constituents. So this is open from 9 a.m. to 7 p.m., 7 days a week. There's no cost. It's centrally located, and it just gives us a little bit of a larger footprint here in Palm Beach County for testing.
Have you noticed, Mayor, that a lot of people have been kind of confused about where they can go get tests now, given that, you know, the mass sites have pretty much for testing had closed down? I know a lot of places like CVS had gone down on the number of days they were offering those tests. So how is this going to help to be able to make that more widely available for people?
Well, I haven't received a whole lot of feedback on the inability to get tested and really on an inability to get vaccinated, which is our main focus. But I think it becomes a little less clear with the private market. So again, we wanted to have that county-run, Department of Health-run option available. There hasn't been a huge demand today, but I think that as we get the word out, as people continue to test to make sure that they're not getting COVID-19 and they're not spreading it, that this will become a very important resource.
Any other efforts in the works? I know that local government has pretty much been a little bit, their hands have been tied a little bit with, you know, current executive orders on what you can and can't do. So any efforts that, you know, the local government is talking about that you can do to help with this issue that we're facing right now with the surges?
Well, our hands haven't been tied operationally in the sense that we can not have sites like this or vaccination sites, but really the private market is handling a lot of that. There is a very large supply of vaccines in the county and in the state. We're very fortunate. I really think it's a function of those that are not getting vaccinated right now, finding a way forward for them, whether it's through education, through watching the rest of us that got vaccinated early, by watching what happens when you don't get vaccinated and you see the admissions to the hospital seem to be 95% unvaccinated and the impacts are much more severe. So really right now I think we're doing what we need to do. You know, there is an issue about the masks in school. That's not an issue that I'm going to take on. But at the end of the day, when you look at where we came from, where we're at now, wearing a mask indoors, getting vaccinated, being cautious about your surroundings, those are personal decisions. And really, we've learned how to contend with this virus, and the vaccine has made it a lot easier to stay safe.
Anything you can say about what feedback you're getting from hospital CEOs? I know the health department is now getting those daily updates again on how they're doing with capacity.
Well, there's certainly some capacity concerns. Right now, we have elective procedures going on in the county and the hospitals. That's a decision that the medical directors will make. But we've seen it get to a point in Miami-Dade and Broward, I think, or also in Orlando, where they're not doing those elective procedures. We don't want to get to that point, but there's certainly a rise in admissions for COVID-19. And on Monday, most likely, we'll have a press conference, and some of the doctors will speak directly to that. It's one thing for me to tell the public what's going on in the hospitals, but we need someone that is in there, that is fighting this fight every day, has been doing this for a year and a half. I think that might be a powerful message, and I hope the community continues to listen to their perspective.
I know back, you know, in May, June, July, we saw a little bit of a dip in those vaccine administrations because people weren't going out to try to get the vaccine. Do you feel like that's going to start going up again? You know, people that are getting vaccinated now because they're seeing the effects of the Delta variant?
I absolutely do. In fact, I think we're already starting to see that rate of vaccination rise. And I'll tell you, in July, if I recall correctly, about 20% of every vaccine given in this county was given to a member of our community that did not speak English as their first language. That's the demographic in particular that there's some confusion about, some concern about what is going on here and why are we doing this. And we saw the rates not so high in those communities, but I'm delighted to see it tick back up, or at least start back on the positive trend, because it's a team effort, and really we need to get vaccinated to reach that herd immunity.
Anything else you'd like to add, Mayor?
Yeah, I just appreciate the public's patience, the practical perspective on this. No one likes wearing a mask. No one likes having to be cautious about how we socialize. But the real reality is, and we all know this, whether we're willing to admit it or not, is that these types of measures are going to be in place. This type of life is going to be in place until we reach that herd immunity. So if you haven't gotten vaccinated, look at what's going on in our community. Look at what's going on in the hospitals. Look how the rest of us have done once we got the vaccine. Look at the science. Whatever it is that you need to do, make an informed decision. And I would encourage you, not just as a county mayor, but as your neighbor, as your friend, to get vaccinated.
We were in such a good place, right? Back in May and June, we were talking about everyone was looking forward to 4th of July, and then after that, we took a dip with the surge in the cases. So hopefully we can get back to that.
Absolutely, and that's going to be the nature of this pandemic. Is it's going to be a series of ups and downs, and it's not going to be an easy process. It hasn't been this far, but there is a way to get out of this way of life, and that is reaching that herd immunity. So I trust the science. I hope that those that are still on the fence about it continue to do their due diligence and research, and hopefully we'll get to a point in the near future where we don't have to worry about COVID-19.
Mayor, do you foresee the Emergency Operations Department also moving up a level again? I know last year we were at, I think, level 2?
Yeah, we were at level 2 enhanced monitoring. I don't foresee that in the future. I hate to put it this way, but really this COVID-19 pandemic has become a war on the unvaccinated. And so right now, the concerns that we have are really in the hospitals. So those of us that are vaccinated, or if you're not vaccinated, you know how to socially distance, you know how to wear a mask. But for those that are getting infected, I think our resources and our expertise as a county will go to assisting hospitals if they reach that capacity. And that's a big concern.
And does that include possibly considering a field hospital if it comes to that?
The one thing I've learned about COVID-19 and emergency operations in general is never say never. We're not there right now. I don't foresee it happening in the near future, but I don't want to say never. And the reality is, if we get to that point, this government, the governments in the state, throughout the nation, we're going to do what needs to be done to ensure the public health. I hope it doesn't come to that, but we are well prepared.